Assalamualaikum everyone, welcome back to this channel. This is me Ali Wahid and you are on the channel of Medicare. So as you know that we have started the practicals of pharmacy practice. We have discussed the first three experiments and now we are moving toward the fourth experiment as the per the requirement of your syllabus is. So our fourth experiment is to dispense a oral solution, oral rehydrating solution that is given when a patient have any kind of dehydration in her body due to any case like the diarrhea, due to vomiting, or due to excessive sweating or exercise. Dehydration occur into our body. So to rehydrate our body we give some oral solution which are prepared by USP method, and we have to dispense this particular solution. So to prepare it, we have given us a prescription, and we have to prepare it or dispense it. And let's move to the things that we need to prepare this solution. So the ingredients that we need to prepare this solution is given below here. So the first and the most important ingredient that we need is our sodium chloride NaCl. And for USP and for BP, every the ingredient is a little bit same, but their quantity is different. So you need NaCl is about 2.6 grams. The second ingredient that you need is the KCl, potassium chloride, and it should be about 1.5 grams. The third ingredient that you need is the sodium citrate. I don't know how to mention the sodium citrate, but I will write it in the words here. So, sodium citrate, and its weight should be 2.9 grams. And the fourth ingredient is our glucose here, and the weight of glucose is a little bit more than all the ingredients, it's about 13.5 grams. And the last ingredient is for sure is the water, which is acting as a solvent here, and which is quantity sufficient to about 100 ml. So we are making the solution of about 100 ml, and we are adding these kind of ingredients so that we can rehydrate our body. We can uh, diminish the dehydration in our body. So how to make it, how to dispense it? So the procedure is very simple. First of all, you have to weigh all of these ingredients accurately by using the weighing balance, and then you will mix all of these ingredients together, and yeah, you have to grind them. So if some particles are larger, then you have to make sure that every particle should be uniform, so grind them in the pestle or mortar. And if needed, okay, if your particles are fine, then don't go for over fining or over grinding them. Just make them homogeneous, mix them, and make sure it is properly fine. And then you have to pack it. You have to store it in the powder form, and then you will dissolve it. You will dissolve all of these ingredients into your solvent, which is the water here, and you will make the final volume 200 ml, and these are the things. So the role of every ingredient we will also study, like the role of NaCl in this case is to replenish the fluid draws. For example, a patient who have like after the vomiting, his body has low sodium level in it, so NaCl will provide the sodium level. So it is replenishing the level of electrolytes. If somebody have the low NaCl, then this oral solution having NaCl can replenish the need of sodium. Similarly, potassium chloride. Potassium is very important electrolyte present within the human bodies, because it is an important component that is present in our all the cell membranes. Our cell membrane, we have a proper balance of sodium and the potassium ions inside and outside. So that's why the low level of sodium and potassium is very dangerous for our body, and so that's why we will give oral solution having sodium NaCl and potassium in the form of KCl, and it will replenish the electrolyte loss. Similarly, the sodium citrate, the purpose of adding sodium citrate is same. It will also replenish the loss of electrolyte. And the second major important role of sodium citrate is that it also correct the acidosis. In this case, glucose is just for increasing the sweetness, and as well as glucose second major purpose is to increase the absorption of sodium and water. Okay, and water, for sure it is serving as a solvent in that case, which is providing the vehicle for this purpose. So this was all about our first experiment, in which we have studied how to make a oral rehydrating solution by the USP method. So this was all about the experiment number 4, and in the next experiment we will discuss how to dispense a oral rehydrating solution by BP method. So these two methods are different. For BP method you have to follow some other procedure. The ingredients a little bit will be same, just their quantity is different. So we will study that in next experiment. So if you like this video, then please subscribe to my channel, and don't forget to press the bell icon so that you can get the notification of all the videos that I have uploaded or that I will be uploaded in the next few days. So take care, meet you soon in the next lecture, and don't forget me in your prayers. Allah Hafiz.